If you are suffering from any chronic health problem and you've been to 15 doctors and you've had all the imaging and all the blood tests, and you go to doctor to doctor to doctor and all of your tests always come up normal, but you're still suffering with vertigo, you're still suffering with Meniere's disease, you still have cognitive problems, you still have pain at the back of the head and your head feels heavy, you have cracking and popping in the jaw, your energy is not as good, your motivation is down, you're not falling asleep easily, you're waking up in the middle of the night and you're not getting deep sleep, you feel like you're in a fog all day long and you're just not present all the way because your body is not working the way that it's supposed to. One of the major contributing factors to people who have chronic health problems are these two bones right here. This is called the atlas, this is called the axis, this is C1. Your head basically rests on that top vertebra. This is C2. 50% of the motion of head turning left and right happens between C1 and 2. It's called the axis, but the most important part is these two bones house a structure called the brain stem. And the brain stem is the part of your nervous system that controls everything in your body that you don't consciously think about, including your vestibular balance centers, blood pressure regulation, muscle tone regulation, all of your internal organ function. Basically everything in your body is controlled right here. And if you're suffering with chronic health issues and you've been to the medical establishment, you've had all the tests, you've been to all the specialists, and nothing is turning up, but you're still left with 10 to 20 or 35 symptoms like I had 30 years ago, do yourself a favor, Google upper cervical chiropractic, do some research. The upper neck structurally houses the brainstem, and that's what runs the show. And if you've had a trauma in the past and that vertebra is structurally locked out of its normal range of motion under the skull, it's going to irritate and interfere with the brainstem, and at the other end of that, if it's been there long enough and is a big enough irritation, you're going to have chronic problems. So in our office, we take 3D imaging of the upper neck to determine exactly how that segment's off. Everybody's different. And then we come in along a very precise angle with no twisting, popping, or pulling. We introduce a force to set that segment back in position with the long-term objective is to get that vertebra back in its normal range of motion. And at the joint level, when you have a misalignment, there's a structural misalignment, it tears the soft tissue. Patient comes into our office 10 years later, it's healed up in that bad position, and we introduce a force to set that segment back in motion. It takes time. So if you're someone who is under care and you've been under care for 2 or 3 weeks and all of your problem isn't gone yet, that's normal. You should have some windows of betterness, but it does take time. Natural healing doesn't happen overnight. But if you want to get to the root cause and actually heal through the problem, time is a necessary factor, and being in alignment is a necessary factor also. So thanks for listening.